man's general health and well-being depend on testosterone. Various biological activities are orchestrated by testosterone, much like a conductor. From energy levels and mood to bone density and muscle mass, it helps manage it all. Throughout a man's life, it plays a role in growing muscle and bone, as well as affecting his mood and energy levels. It has an effect on the brain that aids concentration and memory. Having said that, testosterone production in males often decreases with age. This gradual deterioration could begin as early as the 30s and keep on. Hypogonadism, sometimes known as low testosterone, may develop in certain people if this decrease is severe enough. A loss of muscular mass and strength, along with feelings of melancholy and exhaustion, may be present. Although this loss is inevitable with age, it may have serious consequences for a man's health, including lowering his bone density, affecting his cardiovascular health, and even increasing his chance of developing certain chronic conditions. Understanding the symptoms and possible long-term implications of low testosterone is vital for men of all ages. Early identification and care may help reduce these consequences and enhance quality of life. Regular exams and open communication with healthcare experts are vital. There are different treatment options available, from lifestyle modifications to hormone replacement medication. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and appropriate sleep, helps support testosterone levels. Reducing stress and limiting excessive alcohol intake also have a role. Social ties and mental well-being are equally vital. Engaging in activities that offer pleasure and satisfaction may significantly alter hormone levels. By recognizing and addressing the variables that impact testosterone, men may take proactive actions to preserve their energy and general health throughout their lifetimes. Testosterone is more than simply a hormone. It's a major performer in the symphony of existence, contributing to the physical, mental, and emotional welfare of men. Embracing this understanding helps men to lead healthier, more fulfilled lives, ensuring that the hormone of vitality continues to perform its crucial function. Low testosterone, also known as hypogonadism, happens when the body doesn't create enough of this crucial hormone. Testosterone is vital for numerous physical activities, including muscular growth, bone density, and sex desire. When levels decline, it may lead to a number of symptoms that can dramatically damage a man's quality of life. While it's generally linked with aging, it may afflict males of all ages. Young guys, middle-aged men, and elderly men may all have low testosterone. It's a frequent fallacy that only elderly men need to worry about their testosterone levels. In truth, younger men may also suffer from this illness, which can be very upsetting and unexpected. Several factors contribute to its development, include genetics, certain medical problems including diabetes and obesity, and even certain drugs. Lifestyle decisions such as poor food, lack of exercise, and excessive alcohol intake might also play a role. Additionally, persistent stress and sleep difficulties might severely decrease testosterone production. Diagnosing low testosterone is a simple blood test. This test examines the quantity of testosterone in the blood, giving a clear picture of whether levels are within the normal range. It's a basic treatment that can be done quickly and simply in a doctor's office or clinic. Doctors often assess total testosterone levels in the morning when they're at their highest. Testosterone levels vary throughout the day, and morning levels are normally the highest. This is why it's crucial to get the test done early in the day to obtain the most accurate result. If levels fall below a specific threshold, and especially if accompanied by symptoms, a diagnosis of low testosterone may be established. Symptoms might include weariness, sadness, irritability, diminished muscular mass, and decreased libido. These symptoms might be subtle and develop gradually, making it vital to pay attention to changes in how you feel. It's crucial to remember that a single blood test may not be enough to establish a diagnosis, and physicians typically prescribe repeat testing to confirm the disease. This is because testosterone levels may change from day to day and even hour to hour. Multiple tests guarantee that the diagnosis is correct and that any treatment plan is based on credible information. If you feel you have low testosterone, it's vital to speak with a healthcare expert who can help you through the testing process and explain various treatment choices. Imagine a fire steadily fading. The flames that once danced and flared with such intensity and fury are now reduced to a mere ghost of their former self. The once roaring flames full of life and warmth gradually dwindle, their vitality slowly stripped away by the passing of time and the consumption of fuel, leaving only embers and a faint light. These embers, while still glowing, lack the brightness and vigor of the fire that once was. This comparison effectively captures the experience of many men with low testosterone. Just as the fire loses its intensity, so too do these men find their formerly robust vitality dwindling, the lively energy and zeal for life they once knew begin to fade, replaced by a sensation of exhaustion and disengagement that may be both mystifying and disappointing, replaced by a constellation of symptoms that can damage their physical, emotional, and mental wellness. These symptoms might vary from a lack of motivation and reduced libido to feelings of despair and worry. These symptoms, however, are typically modest and readily ascribed to other things, notably stress or age. Many men may not even recognize that their symptoms are due to low testosterone, instead chalking them up to the normal process of becoming older, which might make early diagnosis hard. Without adequate knowledge and understanding, men may spend years without seeking assistance, enabling the disease to develop over time. Recognizing these indicators is vital, since untreated low testosterone may have substantial long-term health repercussions. It may lead to a loss in bone density, increasing the risk of fractures, and can also contribute to cardiovascular difficulties. Beyond the physical health effects, the emotional toll may be significant. Men may find themselves retreating from things they formerly valued, feeling detached from their loved ones, and struggle with a sense of identity and purpose. Open communication with loved ones and healthcare professionals is vital. By expressing their symptoms and worries, men may take the first step towards finding answers and restoring their energy. Treatment alternatives are available, ranging from lifestyle adjustments and natural supplements to hormone replacement medication. With the appropriate strategy, men may rekindle their inner fire and recapture the vitality and passion that low testosterone has robbed from them. It's about more than simply treating symptoms, it's about restoring quality of life. By correcting low testosterone, men may once again enjoy the warmth and brightness of a life lived completely. Just as a fire may be rekindled with the correct care and attention, so too can the spirit and vigor of men battling low testosterone be resurrected. The flame may have waned, yet it may blaze brightly once again. One of the most prevalent and severe symptoms of low testosterone is weariness. It's not simply the ordinary fatigue that comes with a hectic schedule. It's a continuous lack of vitality that penetrates every part of existence. Men with low testosterone typically remark feeling fatigued even after a full night's sleep. Simple actions that formerly felt straightforward, like climbing stairs or mowing the grass, might seem tiring. This persistent exhaustion may make it difficult to participate in work, hobbies, and even social relationships, leading to feelings of frustration and isolation. Testosterone has a critical function in regulating mood and emotional well-being. When levels decrease, it may dramatically impair a man's mental health. Depression, characterized by chronic melancholy, lack of interest, and feelings of despair, is a typical sign of low testosterone. Along with depression, males may feel increased irritability, anxiety, and mood changes. These emotional swings may strain relationships, affect job performance, and reduce general quality of life. Diminished libido, the flame that's gone. Testosterone is sometimes referred to as the male hormone owing to its crucial function in sexual health. One of the most visible and unpleasant signs of low testosterone is a lowered libido or reduced sex desire. This drop in sexual desire might emerge as a lack of interest in sex, difficulties getting or keeping an erection, or diminished sexual pleasure. For many men, this reduction in sexual function may lead to feelings of inadequacy, humiliation, and pressure in their personal relationships. Beyond its influence on energy levels, emotions, and sexual health, low testosterone takes a toll on physical health. One of the most noticeable changes is a shift in body composition. Men with low testosterone frequently have an increase in body fat, especially around the belly, and a loss in muscular mass and strength. This shift in body composition may make it hard to maintain a healthy weight and raise the risk of developing additional health concerns, including heart disease and diabetes. Low testosterone and chronic illnesses, a tangled web. While low testosterone alone could not directly cause chronic illnesses, it works as a substantial contributing factor, raising the risk and severity of different health disorders. This association between low testosterone and chronic diseases underscores the necessity of correcting hormonal imbalances for general health and well-being. The good news is that treating low testosterone may not only ease the severe symptoms, but also possibly lower the danger or enhance the management of certain chronic illnesses, cardiovascular disease, a severe weight. Research reveals a substantial association between low testosterone and an increased risk of cardiovascular disease. Testosterone has a role in maintaining healthy cholesterol levels, controlling blood pressure, and enhancing insulin sensitivity, all critical variables in heart health. When testosterone levels are low, these preventive systems are weakened, increasing the probability of acquiring illnesses including atherosclerosis, heart attack, and stroke.
Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.